Judith, do you have a program with you? We could send everybody on. We could send everyone in case they don't have. I've just sent to one person. Does anybody else need a program?
ECD Network for Kenya, dedicated to working together through a multi-sectoral approach, nurturing care for early childhood, a society where all children realize holistic development. We promote, support, and sustain a nurturing care environment. A society where all children realize holistic development. We promote, support, and sustain a nurturing care environment. Commitment and inclusiveness, mutual trust, respect, and integrity, partnership and collaboration, promoting ECD environment. A society where all children realize holistic development. We promote, support, and sustain a nurturing care environment. A society where all children realize holistic development. We promote, support, and sustain a nurturing care environment.
Hello, everyone. Karibuni nyote. Welcome to the ECD Network for Kenya Dissemination Webinar Series 2023 to 2024. Today, we are discussing the vital role of collaboration across sectors in nurturing children's holistic development. I am your moderator and host today, speaking from Nairobi, Kenya. My name is Stella Bugwa. This webinar 2 series of dissemination is titled Multi-Sectoral Coordination and Collaboration in Early Childhood Development. And here with me are speakers who will share insights and strategies for impactful partnerships. We know that multi-sectoral coordination and integration is important for our country and beyond. Children's rights are indivisible and they cut across many sectors, including health, nutrition, social protection, education, sanitation, and among others. Providing a comprehensive package of ECD requires an integrated cross-sectoral approach involving all stakeholders. This network is all about collaborating for the holistic ECD services to enable the youngest of children to survive, not only survive, but to thrive and to live to their full potential. A multi-sectoral approach for ECD covers 3 critical periods in the life course of young children. That is survive, ending preventable deaths, thrive, ensuring the health and holistic well-being of children, and transform, expanding enabling environments. Today, I'd like to invite Dr. Isa Kipera, who's the Program and Sponsorship Director of Child Fund. He is also the ECD Network Vice Chair. Dr. Isa, Kenya is now more than ever ready for leadership in ECD at all levels. And we want sectoral policies and plans that contain guidance for multi-sectoral coordination, service integration, and evaluation to demonstrate that outcomes are being achieved across the various line ministries. Please speak to us. Over to you, Dr. Isa.
Thank you, Stella. Thank you, everybody. All protocols observed. On behalf of the ECD Network for Kenya, Board of Directors, and the Secretariat, I would wish to take this honor and opportunity to welcome each and every one of you to this second webinar series, which for this particular one is themed multi-sectoral coordination and collaboration in ECD, as Stella has just elaborated. The ECD network, as you all know, or you might be knowing, is a national membership organization that was established about a decade ago, that is in 2015, to bridge a coordination gap of the ECD initiatives in Kenya. The core mandate of this network is basically to ensure coordinated action amongst all ECD players, and you know there are quite many here in Kenya, and also to be the voice of the children. So we speak for and on behalf of the children in matters of their care. Our vision is to promote strong multi-sectoral collaboration for advancing nurturing care for ECD, which is quite important because it has a lot of social and economic linkages, as you can imagine. The network is a membership organization, currently with 14 members organizations. We also have 59 individual members and 45 advocacy partners. I want to take this opportunity to invite those who have not joined this noble network to do so today. You have an opportunity. Just express your interest and we'll enroll you into this network. The ECD network Kenya works with national line ministries and the relevant county departments through the Council of Governors. Currently, our membership have extended to 34 out of the 37 counties in Kenya. Under research, we are conducting 2 research projects focusing on 1, ECD systems measurements that is guided for 4 thematic areas, and 2, ECD financing, policy, multi-sectoral collaboration, and governance, and also another one on randomized control trial, RCT, that aims at promoting responsive caregiving component of nurturing care. In the area of advocacy, the network is working collaboratively with Lake Region Economic Bloc to strengthen coordination through multi-sectoral collaboration approach, where first spouses, we are using the word spouses because now they are lady governors, so they are not just first ladies. County commissioners, county leadership from relevant departments, and the CSO, national and grassroots, converge to discuss issues affecting children. And a partnership and collaboration, which is our key area of focus, the network convenes national conferences and webinars like this one. Currently, we are in the process of planning the 6th National ECD Stakeholders Conference, which is scheduled for 2025 in Garissa County. The network also launched the webinar series in 2024-25 that acts as a knowledge sharing and learning platform where partners, both state and non-state, highlight successful and innovative ECD programs, interventions, especially those with replicable models in ECD, and sharing of evidence based on research findings, enhancing networking, collaboration among ECD stakeholders. I therefore invite all of us present here today to participate in this great cause. Finally, I would like to call upon all partners to join effort with the network in amplifying children's voices for holistic development. And the key here is collaboration. Thank you, and have a fruitful webinar.
Thank you so much, Dr. Issa, Child Fund, for speaking into the issues of amplifying the voices of what everyone is doing in the sector, and also inviting us to Garissa for the conference that's coming up. And there's a lot of work being done by the network, research, RCTs, which are very rare this part of Africa, the amazing work by LREB, and the work through the first spouses of counties is work that can be replicated beyond the area into other counties that we are working in. So thank you so much for sharing that with us. And next, ladies and gentlemen, all protocols observed. I want to invite Dr. Karemi, Janet Karemi, who is the head of Division of Newborn and Child Health at the Ministry of Health in Kenya. And Dr. Karemi, you'll be speaking about nurturing care advocacy strategy and the role of partners in its implementation. And Dr. Karemi, the caregiving environment in the womb is a wonder and a miracle. And responsive caregiving, which is really dear to your heart, requires a whole of government, whole of society approach to support and reinforce parenting practices. And collaboration across sectors fuels child growth and development. And it starts in the first 1,000 days, as the health sector would have it, and also the 0 to 3s as the childcare sector would talk about it. So please speak to us. Karibu sana, Dr. Janet.
All right, thank you very much, Stella. Thank you everyone for joining and for the opportunity given to present on this area. I hope you'll be presenting from your end. Yes. I hope you can hear me. As Stella introduced me, I'm Dr. Janet Karemi. I head Newborn and Child Health at the Ministry of Health. And I'll be talking on what the Ministry of Health is doing is in advancing advocacy initiatives for ECD. The topic I think I've seen on the program was on the strategy, which is not yet, validated and launched. So I'll talk about the initiatives that are ongoing, some based on that strategy and others beyond that. So the picture that is opening is showing what ECD is. It's not only in the health sector where you can see on the right the child being measured for development, but also opportunities for early learning and all that is encompassing, and that is where we are here today for the child. So I'll share what we've been doing so far. Next slide. I think Stella has done a good job of introducing. So we all know what ECD is, and it has the 5 components there. And it is crucial for ensuring the well-being and optimal development of young children. I always say it's good to give all the children an equal opportunity so that in life, they can pursue whatever dreams that they had. So the ministry employs several strategies to advance advocacy initiatives for ECD in the country. And the first one, next slide, is actually the overall policy developments and follow-up implementation. In the Kenyan space, we are at an area where we have been in the development phase, and hopefully soon, hopefully this will be the year where we finalize all this. And this works to give guidance to the counties on when we talk of ECD, then what are the priority areas, what interventions should be done. So we're in the process of finalizing the integrated ECD policy, and with that will come a detailed multi-sectoral implementation plan. So saying in terms of health, what is the role of Ministry of Health? What is the role of Ministry of Labor and Social Protection in health? Because they do have a role. What is the role of Ministry of Education in health? And also, in the same way, what is the role of health in preventing violence against children? What is the role of social protection in that, such that it's not only Ministry of Health dealing with health only, but we are all involved. In terms of strategies, we have now the draft ECD advocacy strategy, and we have an ECD social behavior change and communication strategy. So the advocacy strategy, how we have now, we did some review, and it targets more of the decision makers, those who are key decision makers at national level, even international level, and the custodians at the community, and those who then can influence resource mobilization and behavior change. That is the main target of the advocacy strategy, and the social behavior change and communication strategy really targets the caregivers and the first, respondents, the healthcare workers, the community health promoters, we have lay volunteer counselors, we have the child officers. So it targets them in order to reach the caregiver, so that then the child benefits from this nurturing care. So in the advocacy strategy, now just please go back. The key objectives in the advocacy strategy are to attain high-level political goodwill, commitment, and increased investment for nurturing care for ECD, and to strengthen multi-sectoral coordination, which I think all the speakers before me have mentioned, because without this, then we will not ensure success. And then to increase public awareness and education so that there is improved knowledge, attitude, and practice for nurturing care for ECD. Next slide. So after policy and strategy development, then we go into the guidelines. As the Ministry of Health, we've been able to incorporate a lot of ECD messaging into our mainstream work in terms of newborn care. So we've integrated messages on ECD in the KMC's Kangaroo Mother Care guidelines, where we are talking about that skin-to-skin contact, which is important for, and that is part of the ECD messaging. In terms of, we have guidelines for caring for the cord using chlorhexidine to prevent infection. We have incorporated ECD messaging there. We have our comprehensive newborn care training package for training of healthcare workers to deal with the sick and small newborns. We've included messages on health and nutrition there, and even on the responsive caregiving. We've included messages on ECD in our mother-child handbook, although the public of her follow-up up to 5 years after the baby is born. So it incorporates ECD messages right from antenatal care all the way 5 years. And then we have the ECD, we are planning to have the ECD module integrated in the community maternal newborn care module, so that we also don't burden the CH with too much information, so that we're only picking what is not already contained in the existing module to incorporate messages on responsive caregiving, opportunities for early learning, and safety and protection. And then following that, then of course we'll have capacity building of the community workers, and it's cross-cutting. And this multi-sectoral coordination is the reason why we need to review this ECD module, because previously it was designed as a module for community health promoters. But now with the integrated approach, we are looking at having this same module train child officers, lay volunteer counselors, and even early childhood development education teachers. Next. The other major thing is partnerships and collaborations. In all this work that we're doing, we are working with the Ministry of Education, Ministry of Labor and Social Protection, which encompasses the National Council for Children's Services, which is now charged with advising the government on all matters to do with children. So even in terms of the policy, they are the ones who are spearheading, but of course we are also supporting the finalization of that policy. So working with the Directorate of Children's Services, Directorate of Social Development, which is still under Ministry of Labor and Social Protection. And as an example, even in partnerships with the Directorate of Social Development, we are working together on the positive parenting program. Then we have partnerships with counties. We already have some counties which have programs, and we are learning from them. So this is a good case study where actually we are learning from the counties, then using that learning, hopefully in our strategies to spread the practice in all other counties. Then we collaborate with development and implementation partners, and you can see the examples there. All these partners have been critical in the support given in developing all the documents that we have right now. And we also have private entities like at the Khan University who have supported in terms of training leaders. They have developed curriculums on training leaders and policymakers on ECD. We also have the Kenya Pediatric Association, which is very vocal in terms of ECD and has developed ECD training packages, short courses for healthcare workers. Next. So that's just an example of partnerships and collaboration. This is a learning session in Siaya where we were learning about their playbooks, where the children, before they are seen at the child welfare clinic, after they are weighed, then they have ECD messages given by the community health promoters and the nurses there in terms of assessing their children's developmental milestones to know by 6 months a child should be sitting without support, knowing how to engage them and the importance of engaging them to provide nurturing care. And also we have learned from the strategic plan in developing the national one. Next. Community engagement is important in the health sector. The government is now supporting the community health promoters, who we see as the key vehicle of delivering these ECD messages in the community across all the counties, whether rural. Next. Monitoring and evaluation is a key accountability and so in the health sector, we do have robust monitoring mechanisms for nutrition and for health. And we've also incorporated key indicators in our Kenya Demographic Health Survey, so we know what percentage of the children are developmentally on track by age, and therefore we can, in the next Demographic Health Survey, hopefully we'll also be able to break down by county so that we can also target our interventions better. And then we are working with the Ministry of Labor and Social Protection, NCCS, who are charged with developing an integrated monitoring system, and we will work with them so that we have one dashboard or platform where we can see all the ECD indicators and respond appropriately in terms of service delivery and policy. Next. So this is an example that learning also takes place through conferences. We've had the conference which was there in Turkana, ECD Network, Kenya ECD Network led that, and you're planning the one for Garissa, and also we have the international conferences. Therefore, they are important platforms for learning, and we are supportive and participate in these forums. Next. So in terms of awareness campaigns, we've been doing awareness campaigns for health, for nutrition, maybe for social protection separately, but with now our social behavior change communication strategy, we also have the information, education, communication material so that we plan to do mass media campaigns so that the public can be more aware of what nurturing care for ECD is and their role in ensuring that they provide it. Next. So those are the successes which have been mentioned through the other presentation. We'll finalize our policy and the strategies for advocacy, social behavior change. Over the period I've been in the ministry, I think we've developed strong multi-sectoral coordination with the other sectors. And as we develop the policy, we're also developing the implementation plan to support the counties to know what are the key areas for ECD interventions. And we are planning to review the curriculum for ECD training to go beyond the community health. So I think then We've had some challenges. The biggest has been funding, of course, from the government. Incomplete mapping of stakeholders, and I want all those who are here to be in touch with us so that we know who is working in which space in ECD. The lack of integrated data system and lack of standardized guidance to counties. I feel like all this will be addressed in the policy and the plans. When you do the implementation guide, the dissemination, then it will become all clearer. So it's a bright future for the ECD in Kenya. So I think that was my last slide. This is evidence of multi-sectoral collaboration. You can see Honorable Sophia Abdul, who is the board chair of the National Council for Children's Services. You can see Bishop Bernard Jerome, CCS. We have Evans from Ministry of Health. We have Kamlas from UNICEF. We have Director Emis from Ministry of Education. So when we work across board, and I really want to applaud those efforts and ask that we keep it up. Thank you.
Thank you so much, Dr. Karemi, for highlighting that multi-sectoral coordination is happening and that everybody is involved and there are many strategies underway, and also highlighting M&E and safeguarding of children as something that is being done collectively. Thank you very much, Dr. Karemi. Next, we will have Alex Mwaki, who's the County Director of Safe Water and AIDS Project, SWAP. Alex implements public health programs, research, and emergency response. You are a leader in providing innovative solutions for improved health and economic status in communities. You are implementing a scalable, evidence-based parenting intervention in Western Kenya, and this has been happening since 2018. And together with the network and University of Southern California, you scaled achieving sustainable ECD impact at scale in a Kenyan RCT that is experimentally testing relative effectiveness and cost effectiveness. There's mHealth delivery models for an ECD responsive parenting intervention targeting mothers and their children aged 6 to 18 months in a randomized adaptive trial. Karibu sana, Alex.
Thank you so much, Stella, for that introduction. So from SWAP, I'm going to present, and I'm joined here by my colleague, who is Eddie Palu, the programs manager, as well as the principal investigator. So as it's mentioned, I'm going to share with you our responsive parenting, looking at mHealth approach or mobile-based approach. Next slide. Yeah, so about Safe Water and AIDS project, abbreviated as SWAP. We are an NGO which was established way back in 2005. We are based in Kisumu City, but operating mainly in Western Kenya. Stella has already mentioned about our mission, vision, and one thing that I am proud to mention here is that we are also an award-winning organization. We recently won an Energy Globe Award. Last year, we won 2 awards. That's the Global Water Award and also the Medical Research Council Award for Outstanding Team. So far, if you visit our website, we have published over 65 articles in international peer-reviewed journals. Next slide. So brief background, worldwide, we know that 43% of children under the age of 5 will not be able to reach their development potential. And this is attributed to poverty levels. Again, impacts of parenting programs on ECD generally positive, but most are delivered through home visits and not scalable in low middle and income countries. We have tested group models and which are more scalable, positive evidence of responsive parenting, through an integrated curriculum. And this has already demonstrated positive outcomes in Uganda, Bangladesh, and Kenya. In Kenya, we did this way back into 2018. But the problem still lies on limited evidence for short to long-term effectiveness and cost effectiveness of the group parenting programs. Next. So our achieving sustainable early childhood development impact, which we popularly refer to as Msingi Bora, Kiswahili word for good foundation. We are currently implementing in 2 counties, that is Kisumu County, mainly in one specific sub-county, that is Kisumu West, and Vihiga County, where we are currently implementing in 2 sub-counties, Hamisi and Vihiga. In our first initial project of Msingi Bora in 2018, we worked in Sabatia sub-county of Vihiga County. Next. So Stella has already mentioned our objective, and as she said, it's a collaborative project that we are implementing with the ECD Network Kenya and the University of Southern California, where we want to test the relative and the cost effectiveness of the 2 delivery models, which is in-person and remote session for the ECD responsive parenting. We have enrolled households with children 6 to 18 months for the adaptive trial. Next slide. So our methodology, we have enrolled 60 villages across the 3 sub-counties. And in those 60 villages, we have randomized into 3 arms. So the first arm, where we have 20 community health promoters who are essentially our delivery agent, are conducting in-person group-based delivery. And this is featuring 16 bi-weekly sessions over 8 months. And then we have our second arm of 20 villages headed by the community health promoter, who are delivering a hybrid intervention that is combining in-person and remote session. Remote, I mean use of smartphones. And then we have a control group of 20 villages where the community health promoters are just doing their usual service delivery. So interventions in arm 1 and 2 is delivered using the same content. On your far right, you can see the curriculum that we are implementing, which has a total of 16 sessions. And in arm 2, the curriculum is partially adapted to a mobile platform. Next slide. So this curriculum emphasizes on 5 key messages. So during those group sessions, we have a large poster that has issues to do with ensuring that households observe good nutrition or feed. Then issues about safe water, hygiene, sanitation. And for hygiene, we emphasize a lot on hand hygiene. Then there is the key message, which is about play, child talk, and then love and respect from the parents. So each of the families receive a small poster of this big poster that we normally would provide during the sessions. Next. So our unique feature here is the mHealth approach. And this is essentially the second arm where participants are given smartphones. We have already given out to 324 smartphones, those that are assigned in this second arm. And we conduct rigorous training on phone usage, considering especially child protection rights and safe use of social media. In the photo on your right, it was one of the sessions when we were doing the phone distribution and training. And as I said, we are using community health promoters as our delivery agent. In our first Msingibora project, we had identified some 7 mentors who work hand in hand with those community health promoters. And again, they have also received the smartphones. So these smartphones are given to the participants and including the CHPs have 3 applications. One is on ECD app called Survey CTO that is used for data collection and transmission. Then we have a video LAN client to help organize and play videos and audios. And then we have the WhatsApp group platform that helps them to support mothers remotely. Then on mHealth approach, we have encountered several challenges about internet. We have one specific village like in Kisumu where coverage is poor. Of the 374 phones that we have issued to the households, already one is lost. And then participants are not adhering to some of the proper phone use. Next. So in conclusion, we are recommending that there's needs for implementing evidence-based cost-effective programs. We have noted that this group-based models are structured curriculum which are found acceptable, adequate, and engaging the community and even the parents. So we are still currently testing the hybrid model, and soon we'll be sharing details of what is the outcome when we integrate use of the mHealth application. Thank you so much for listening to us, and we'll be looking forward to hear your questions at the very tail end.
Thank you so much, Alex, for that and telling us about what you're doing in regards to cost-effective programs and structured curriculum. Please keep us posted on what's happening. Thank you very much. Ladies and gentlemen, we'd now like to invite Mr. Kizito Wangalwa, the Director of Programs and Committees at Council of Governors. Mr. Kizito, you are coordinating the work of sector committees for advancement of policies, laws, regulations, and administrative actions that enhance service delivery and the common interest of county governments in Kenya. You are a seasoned
Can anyone hear me?
Yes, we can hear you.
Seem to have lost the moderator.
Here too, maybe she has lost her network.
Yes, I think she has lost her network. But I believe, Mr. Kizito, if you can hear us, you can continue.
Yes, I can hear you. So I think I'll just proceed for the interest of time as the moderator finds her way back. Great, thanks.
Welcome.
Thanks for
welcome. Yeah.
thanks, Stella, and thank you for inviting me and by extension the Council of Governors to contribute to this very noble conversation. I will start by just structuring my presentation into 3 phases. One, a little of where we are coming from. Why are we having a discussion on ECD right now, and especially 60 years after our independence as a country? Then I will look at a few parameters that provide a framework for investment in ECD, especially by county governments. And lastly, put forth a few observations and recommendations on how we can be able to reinforce our agenda on the care for the children. If somebody who is helping me can proceed. Basically, we are looking at a framework where child care has been very well handled as a household issue and a community issue. But we are recognizing changes in settlement, urbanization, livelihoods, absentee parents, mental health, all these things that essentially contribute to lessening the attention towards the welfare of the child. And you will notice that even in our local governance structures right now, there is very little of communal care. I think the child was a community asset and everybody cared what is happening to a child. But with the collapse or lessening of the communal care and the collapse of traditional leadership, we see therefore the child becomes very vulnerable. You'll also note that therefore there is almost an arm's length intervention by the teachers in our institutions, the roles that the teachers played, and the religious institutions. Everybody is confining themselves to what they are asked to do. The teacher is asked to go and deliver a curriculum, for example, and therefore the other issues about the child are not taken care of. But we also note that some of these community cultural aspects have worked to the disadvantage of children. The issues, for example, of not taking children to school, the issues of FGM, child labor, and essentially the denial of very basic rights of the child, which are normal in a community, in a cultural setup in some instances. Now, with that in mind, we also look at government, and government has really compartmentalized the child. Where is child health services, home economics separate, water and sanitation, education services, who is taking care of daycare, who is taking care of registration services, who is taking care of criminal actions against a child, who is taking care of parenting services. So you find that the government is also so compartmentalized that the care for the children, everybody looks at it in the lens of my mandate. And the mandate might be so narrow that then we lose out on the holistic intervention on the child. So just moving forward, before 2013, you'll find that the NGOs and civil society have continued to play a very, very critical role in ensuring that the rights of the children are protected. And even the first Children's Act that we had, I think, early the turn of this century, it was basically a push that we had from the NGO sector. And the role that the children's officers played and continue playing even now as we speak has mainly centered on, waiting on there's an abuse of a child, a parent has coming to complain that the father is not paying school fees. So it has been more administrative, waiting for complaints. But we really would want to move away from sitting there to wait, but a holistic attention to the welfare of the child. The ECDE, education of the children, for example, where was ECDE before the new constitution? It was basically in the hands of the community and the non-governmental sector. How come we still see birth registration? A child reaches primary school, reaches class 8, reaches an at a stage where they have to get an ID at the age of majority. They don't have a birth registration certificate. So this is the compartmentalization that we have still experiencing. And at times, when we look at the county governments, devolution is barely 11 years old, including the 3-year transition phase from 2013 to 2016 was a transition phase. But actions of the county governments, people are expecting that the county governments should be equated to actions that should have been pioneered, implemented by national government over a 60-year duration of our independence. So in the perspective of the county governments, we really think that childcare is a very localized issue and best administered at the level closest to the people. And that is the county government. And when you look at the foundations within the Bill of Rights, the duty on the state to ensure that the rights of the children are assured. And the state is well defined. The state is not national government. The state are all organs of the state, and governments are principal organs of the state. So county governments have a duty of ensuring that the rights of the children are given. Look at the economic and social rights, the rights of the child. It is all crafted in duties of the duty bearer is the state. And therefore, looking at our constitution and having the 2 levels of government, we really look at a situation where we look at the entire constitution, not just the 2 elements within Schedule 4 of the constitution, to see what county governments are supposed to play. County governments are organs of the state, and they must therefore play a very critical role in terms of assuring the rights of the child. Of course, the same constitution says county governments should get enough resources to perform the functions allocated to them. But as we speak right now, we haven't even done the costing of functions. So the formula that we use to assign resources is still hazy. It is not related at all to the discharge of a specific function. So when counties are lobbying for 450 billion, for example, of the equitable share, it might not necessarily be saying that for us to deliver the agriculture function, this is the quantum of resources we need. For us to deliver the child care function, this is the quantum of resources that we need. It goes even further, that now once we have gotten the equitable share between national government and county governments, there is a formula that is used to allocate resources across the county governments, the 47 county governments. Look at all these indices: a basic share, a population index, a health index, an agriculture index, an urban index, poverty, land, roads. Where is, for example, ECD, education, which is a child-friendly service? And where is ECD now, if we have to look at a comprehensive child care service? It is not part of that index. And so when we are looking for ring fencing the resources, really you find already the foundation of resource allocation is skewed against the care for the children. However, we have a very comprehensive planning framework for county governments. We have the CIDPs, we have the sectoral plans, the spatial plans, the annual development plans. So when we have discussions with the county governments and we do not, for example, input sufficiently interface with the county integrated development plan, we lose a 5-year horizon. Like now, the county integrated plans were all done by end of last year. So if we did not influence the conversation around the CIDPs and therefore what will be informing the annual plans of the county government, we lose a 5-year planning horizon, or at least 2.5 years, because the review of the CIDP is after 2.5 years. We do not have sufficient data, for example, to inform part of this thinking, the issues that we need to deal with that concern the children. Do we have all the data And does the county therefore have all the data that is required to be able to inform the interventions with regard to children? But finally, we have sectoral plans. Do we have any county, for example, or a majority of the counties having an early childhood development sector plan that then comprehensively looks at the needs of the children and how, as a county government, we are going to intervene? This could be one of those sectors that is still hazy and nobody has really come out proactively to start looking at ECD sector plan for each of the counties, which is a long-term, a 10-year plan that then the CIDPs and the annual development plans borrow from that long-term planning horizon, be it on issues of children's health, be it issues of parenting, be it issues of WASH, be it issues of education for the children, and basically the comprehensive child care framework. And lastly, you know, we have the Finance Act that gives us the entire budgeting framework, which again, I would be inviting that if we can intervene in the planning processes and the budgeting processes in the county, we will be influencing positively county governments to provide resources towards the care of the children. Now, moving forward, having given that background, what I see missing and which we must work on are clustered into 5. One, if we could move on the slide, please. We note that there isn't sufficient advocacy around institutionalizing county governments as duty bearers. We need to demystify ECD and lessen the latent tension between national and county governments on issues ECD. Can we make the county governments see themselves as duty bearers? The advocacy around that is still missing. Look at the Children's Act. Look at what is provided under Section 54, Section 55. Those two basically provide a stakeholder forum. It does not commit the county government to anything. Those are stakeholder forums at the county level. They don't commit the county government. Look at Section 61 and 62. Are they sufficiently aligned to the powers bestowed on county government in Article 179 and Article 185 of the Constitution? I would say no, because they're only speaking to two things: child care facilities and ECDE. How about nutrition? How about WASH? How about immunization? How about the entire healthcare framework, which is devolved? So the Children Act, in defining the space and the scope of county governments, is quite deficient. And therefore, we cannot use it as a tool to now lobby county governments sufficiently to be able to provide adequate resources and ring-fence them for the welfare of the children. Secondly, resource allocation is a political process. It's not a technical process. It's a political process. And I want to borrow from national government what has happened recently on the affordable housing. How many attempts has the affordable housing been pushed back to the courts and back to the president? And the president, because he's passionate about it, has come out and looked for all avenues to ensure that he gets it right. Have we done the same to the county governors, to just make them see that they have a duty, let alone even the county government as a whole? The county governors? Maybe not yet. Have we used sufficiently the convening power and the voice of the Council of Governors to be able to push this as now a priority agenda? Maybe not yet, but we are getting there, which I'll speak to at the tail end. And how about the county assemblies? Have we sufficiently mobilized that political wing which approves the county budgets to see that as a key responsibility of the assembly members as they pass their budgets? Maybe not. So let's, in the resource allocation, let's leverage on all the devolved functions that touch on children, not just the two things that mention children, child care centers and primary education. Let's leverage on all Schedule 4 functions, Part 2 of Schedule 4, that talks about agriculture, that talks about health, that talks about water, that talks about shelter, which are devolved functions. Then we need to now, having done those two, anchor our advocacy into the budgeting process at the county level. And we need to help the counties to provide the evidence, the data, and the technical support for mainstreaming the children's issues. What I usually do not comment, for example, is wanting again to compartmentalize that unless we see ECD, a CEC in charge of ECD, then we have not seen ECD. There are ECD issues in health. There are ECD issues in agriculture. There are ECD issues in WASH. There are ECD issues in, as long as we do the mainstreaming and can mainstream, we will start seeing higher budgets being allocated for child-friendly services within different sectors, but well resonating with informed action and evidence. Then I talked about the education index missing totally. Can we also, as we do this, lobby for that education index to be part of the revenue sharing formula that is being worked on? The process of preparing the next revenue formula, the revenue sharing formula for the next 5 years is going on. Can we also plug into that and influence that sufficiently? Having done all this, then ring fencing will be the easiest thing to be done, because we will have had a very deliberate advocacy strategy. The governors, the county governments are aware about their duty, and we can move on. From the council level, in fact, the whole of today, I have been on ECD matters. I had an early morning meeting with AFCAN, speaking to how we can be doing this. I had a late morning meeting with UNICEF, speaking to this very agenda of ECD. And we have committed as a Council of Governors through the ECD network to provide a platform where this advocacy for ECD can be pioneered. We have a G7 strategy on women leadership. We can have a G47 strategy on ECD. I thank you.
Thank you so very much, Mr. Kizito, for your wealth of wisdom and for reminding us that the issues that we talk about today are not a technical, but a political process, and that stakeholders need to function, or every other function under Schedule 4, not just childcare and ECDE, and that we need to anchor advocacy in the budgeting process. Thank you so much. Ladies and gentlemen, we are nearing a very critical stage of ending the webinar. Please stay with us for a bit. We welcome Luala Community Alliance, Philip Omondi. And Philip, you have co-authored several publications. Family-centered early childhood development is your area of expertise. I know your work from a multi-country research on positive discipline and skillful parenting that was conducted in Kenya, Uganda, Ethiopia, and Rwanda, and you are the county lead there. You are an ECD specialist with a lot of experience in child protection programming, system strengthening, and a core PI in family-centered ECD evaluations. You sit in several technical working groups, including the work that we are doing on the ICD policy and various strategies that we are developing. And also you've done Teacher's Handbook on Positive Discipline and strategies for implementation in partnership with the Ministry of Education, TSC, and Teacher Service Commission, and Kenya Institute of Curriculum Development, among other development partners. So indeed, you are doing multi-sectoral work across sectors. Welcome. You have very few minutes. Karibu sana, Philip.
Thank you, Stella. And my presentation is going to answer the question. And I'm going to give the context of the community. How do we ensure we are having multi-sectoral coordination at the community level? And also in my last slide, I also talk about the sub-county multi-sectoral coordination. Next slide, please. So in Luala Community Alliance, we envision wholeness of life in Luala and beyond. And this is our reach. We started in a ward in Rongo sub-county. Then we moved to the whole sub-county in Rongo. Then we scaled this up to 3 sub-counties, Awendo, Rongo, and Atike sub-counties. Then currently we have presence in a number of counties in Kenya. We are now in Migori, the entire Migori County, Homa Bay County, Baringo County, and some work we are doing in Mombasa, Garissa, and Kilifi counties. And the 2 brothers you're seeing here, we are joining the aspirations. And these are the founders of Luala Community Alliance. And I want to invite us to their website. You can read about their story. And now when I read about their story, it's making me to stay longer in Luala Community Alliance because it's a moving story that can make you stay longer. We also have a model. We have a clinical excellence hospital. And this is the hospital you're seeing there. And this is a level 3 hospital. And this is where we started. Next slide, please. Thank you so much. So this is the model that we are working in Luala Community Alliance. This is our solution. In Luala Community Alliance, we are implementing a community-led health model. And I started by saying that I'll give them multi-sectoral coordination at community level. So you can see from the thematic area, the 4 thematic areas. And in the first one, I'll talk about the professionalization of community health worker. In this, we work through with the Ministry of Health, and we work with the Ministry of Health to recruit, to train, to supervise, to digitize the work of a CHW. Currently, we call them CHPs, and even to give them some stipend that can make them work on a daily basis. So we are really focused on this as a model, because we really want to work with the communities and the families. So our CHPs conduct our household visitations, they conduct our group parenting sessions, and we make sure that we make their work to be professionalized so that they can give quality health care at community level. Another component is now community committees. We are not leaving any structure behind. We are working with a lens that we want to look at a multi-sectoral coordination at community level. At community committees, we are working through the community health strategy. And here we are trying to bring on board community health committees together. This is the committee that supervises the work that a community health promoter does at community level. So at this committee level, we also do more capacity building. We take them through trainings. For example, we train our committees through basic module. We also take them through community scorecard module so that we can make them empowered in asking for quality healthcare services in the health facility they are attached to as a community health unit. The other component we work with at community level is public health facilities. Under this, we promote clinical trainings, we promote quality improvement in these health facilities so that you can have a linkage from level 1, which is the community, to the health center. Then, of course, all our work is data-driven. We are having innovations, and all our work is research-based. So before we start any intervention, then we have to do a baseline survey so that we can have a measurement at maybe at midline or at 1 year. We can see, are we making impact or not? So this is the model that we are implementing in Luala Community Alliance. Next slide, please. Next slide. Thank you so much. So this scale-up has been made possible with the funding from Community Relief. Previous slide, kindly. Yes. So this work is made possible with the funding that we got from Comic Relief, and we're able to do this number of activities based on the model that I've just mentioned previously. We are having a baseline and midline evaluation that we conduct, because I've mentioned that we are working with all our work is research-based and data-driven. So we have trained all our community health promoters and all our community health assistants on nurturing care. So in nurturing care, we are giving the 5 components, all the 5 components. The previous slide, please. Then we also have group parenting sessions and even household visitations, where caregivers are able to counsel our caregivers on the importance of play and communication, age-appropriate play and communication, and even identifying the relationship between the caregiver and the child. Then we are supporting quarterly multi-sectoral coordination at the sub-county level. We do support birth certificates registration and issuance to children who are under 5 years. Then we also do supportive supervision. We empower our community promoters through spot checks and accompaniment, just in a reflective supervision. Then we also participate in ECD policy development, advocacy review, and the SBCC package that we are eager to launch in the next week. Then, of course, we are also empowering our healthcare providers on care for child development, so they can also identify this relationship between the caregiver and the child, talk about age-appropriate play and communication, and counsel our caregivers on the importance of play and communication. Next slide. Next slide, please. Yes, so this is the multi-sectoral coordination that we are talking about at the sub-county level. And we are guided by Section 41 of the Children Act that establishes the National Council of Children's Services. And you talk of the Children Act 2022, it is the one that repealed the Children Act 2001. And it now establishes the National Council of Children's Services in Section 41. Now, when we talk about the National Council of Children's Services, it is now cascaded to the county, sub-county, ward level, and to the lowest level, even location, through Children Advisory Committee. Previously, we were calling them the Area Advisory Councils. Now, in Rongo Sub-County, we are working through the Rongo Sub-County Children Advisory Committee. And that is where we discuss all matters of ECD. We set the agenda of ECD in the sub-county. And that's where we will do political dimension of early childhood development. I also want to give a lesson I learned in my previous implementation, where in the program detailed implementation plan, we were supporting 2 committees quarterly. One committee was called Multi-Sectoral Coordinating Committee, and another committee was the Area Advisory Council, the currently Children Advisory Committees. So the 2 committees were meeting maybe in a month, in a quarter. And do you remember that? Can you imagine that I was meeting the same people differently in 2 meetings? So from that, we drew a lesson that we really want to have one committee. And that's how we now agreed that we work through the Children Advisory Committee, because this is also established and anchored in the law, the Children Act 2022. So the 2 committees had the same composition. Like when I was meeting the Multi-Sectoral Coordinating Committee, let's say the first week of the month, when I was meeting the Area Advisory Council Committee in the second week or the third week, I was meeting the same people. And that's when we drew a lesson that can we work with one committee? And we drew a lesson that there was no need of other ECD TWGs, where participants will be borrowed from the Children Advisory Committees. Then we just adopted the strengthen the Children Advisory Committee through trainings and support the professionalization at all levels. Then government, we are calling upon the government to fund the professionalization of the Children Advisory Committee at all levels. Currently, when you go to these committees, they are surviving with the support of other parties, but the funding from the government is very limited. And that's what we're calling for, so that the government can strengthen the operationalization of the Children Advisory Committee at all levels, up to the sub-county and even at the ward level. Now look at the composition of the Children Advisory Committee at the sub-county level. And this is based on the previous operational guidelines, 2015, because currently National Council of Children's Services are now developing the operational guidelines. But look at this this composition. The Deputy County Commissioner is the chair, Sub-County Medical Officer of Health is a member, Sub-County Children Officer is a member, Sub-County Probation Officer is a member, Sub-County Director of Education, Sub-County ECD Coordinator, representative of National Council of Children's Services, Sub-County Administrator, 3 NGO representatives, 2 faith-based organization representatives, the OCPD, the magistrate, Registrar of Births and Deaths, and then the Director of Public Prosecution. So team, I want to invite us to this composition and tell me if there's any ECD TWG that can be formed separate from this composition. And that's why we do a lesson that let us work through this committee, and then we can just have a subcommittee so that we can call it an ECD multi-sectoral committee based on this committee, because this composition is representative enough and can coordinate, can be quality coordination of early childhood development at the sub-county. Next. Thank you very much, and I will invite all questions and answers. Thank you, and back to you, Stella.
Thank you so very much, Philip, for that, and highlighting the fact that ECD multi-sectoral committees need to be there at county and sub-county level. Ladies and gentlemen, we are nearing the close of the session, and I just need a parting shot from each of our experts. And starting with Dr. Karemi, maybe a sentence or two on your question. MOH, what are the challenges facing collaborative efforts in mending different sectors with the ECD issues in Kenya, and how can we effectively strengthen the national coordination team for ECD? Over to you, Dr. Karemi, parting shot.
All right, thank you, Stella. Thank you, everyone, for their contributions. I've learned a lot. The strengthening is basically through mechanisms like this, where we've heard from people from all different backgrounds from COG. I've really, I think, learned a lot from COG, and I'll make a phone call after that. And that is how we strengthen multi-sectoral coordination, by actually actioning what we talk about, that this should not be just a webinar, then we leave empty-handed and don't do anything about it. I'm sure we can all apply something that we've learned today to take the ECD agenda forward. So thank you.
Okay, it is like Stella is either dropping or something. She's having some challenge. Maybe we can have a parting shot from our next presenter. Maybe the chair committees, Kisito, please.
Dr. Moma, you have promoted me to chair committees. I'm director.
Oh, sorry. Yes, director committees. Sorry.
Yes, I think from our end is the council is totally technically right now aligned to issues of ECD, and we are looking forward to collaborate with all other stakeholders to embed these actions within the county governments as duty bearers for the welfare of children. So it will be a long journey, but it has started. And I look forward to collaborating with all of us to be able to guarantee the welfare of the children through the county governments. I thank you.
Thank you so much, Mr. Kizito. Luala Committee Alliance, parting shot.
Thank you so much, Stella. And I want to invite us to the 5 strategic actions of nurturing care. And the first one is leading and investing in early childhood development. And these are also the aspirations of the framers of the ECD policy. We want to commit the government to lead and invest in early childhood development. Then as partners, as government, we really also need to focus on families and their communities as a second strategic action. Then let us also strengthen services. Let us work with the government so that we strengthen their services to offer quality services to their citizens and children. And let us also work on to monitor progress. We also need to improve our work on M&E and even include the indicators of early childhood development, mostly responsive caregiving, safety and security, and early learning opportunities indicators in the DHIS. And let us scale up and have innovation in early childhood development. Thank you, and back to Asa.
Thank you so much. Swap, have we said something? A parting shot? Alex?
Can you hear me now?
Yes, we can hear you.
Okay, great. Thank you. So for SWAP, we are doing positive parenting through the 5 key messages that we talked about. Issues about feed, wash, play, talk, and respect. And this is in partnership with all the stakeholders, including fathers who are emerging to be positive in terms of ensuring that the children in households benefit from this international curriculum that we are integrating through the support of the community health promoters. And we have embraced the spirit of partnership right from the grassroots at the household level, village level, national administrative, government administrative officers, to the partnership that we have even with the network. Thank you, and looking forward to subsequent series.
Thank you, everyone. Experts, you are all doing an important, phenomenal job parenting those that are dear to you and many more. I'm also a parenting coach, and I love everything parenting because we are passing what we know to the next generation. So before we close out, I'd like to invite Dr. Teresa Moma to just give us one sentence as we close off. Thank you, everyone, for being here, and see you soon.
Thank you.
Dr.
Thank you
Teresa.
so much, our able host, Stella, our able facilitators or panelists, Dr. Karemi, Alex, Mr. Kisito, Philip. Thank you so much. I also want to thank our Vice Chair, Child Fund, Dr. Issa, for creating time to join us. He had to drop because there was a meeting he was to start. And to all our participants, we thank you so much. This webinar would not have happened if you were not here. Thank you so much, and keep an eye for the third webinar, which will be coming very soon. And based on the very many questions that you asked, some of which have been answered, some of which have not been answered, we are planning to organize for webinars around those, and we invite experts to come and authoritatively talk about what they are doing, issues around education, issues around children's nutrition, and the like. So please keep an eye on this space, and we truly appreciate your support. Thank you, thank you, thank you.
Bye, everyone. Thank you. Thank you.